So, if you are joining us now, what's the hashtag that they should comment, Doc?
Yeah, it's hashtag Dermclinic to the rescue.
Ayan. So, Dermclinic will be your hero, of course. So, guys, we have a randomizer that will pick 5 of the lucky winners to win 1,000 pesos GC. So, let's get right into debunking myths. All right. So, earlier we were talking about skin and what sparked your interest. So, how did it spark nga ba, Doc?
I had atopic dermatitis or skin asthma when I was younger. So, normally, the easiest way to explain it is my skin gets easily dry. So, I easily get rashes, or I was also allergic when I was younger to chicken.
Oh,
So, but it's good that along the way, it got resolved.
Oh,
so
that's
now,
good. Yeah, yeah.
I don't have allergies anymore.
yeah, that's good. So, like, it started with the allergy, and then later on, how did you like parang want to?
I
join?
had, in grade 4, I had rashes on my arms.
Yeah, sa
here.
mga
Both,
yeah,
dun sa mga siko. Sa gilid ng siko, and then the areas where naiinitan. Also under the
Yeah.
knee. So, those were the areas that I had rashes. So, my dad would always have me go because we stayed there in QZ. Tapos, merong clinic na malapit, Dermclinic. So, I would always be there kasi they would check my skin. So, basically, it really didn't, that was my encounter. But, along the way, I guess I kind of was familiar already because when I was younger, when I was in preschool,
Yeah.
my dad would always bring me to the clinic. So, like, the clinic was kind of my playground.
Your playground.
Yeah.
Wow.
Like, after class, right, you don't have anything. So, I just go there.
You go there.
Because my dad wants me to go there. And sometimes, I had a yaya before.
Yeah.
That's a close family friend. So, usually, when my dad treats her,
Yeah.
I was watching. So,
Ooh.
normally, ganon. So, I kind of got interested. So, I think while I was growing up, it became natural that, I think I want to be a doctor. I think I want to be like my dad. So, it started off like that. But, I think, in med school, that's when I really looked into, is this something that I really liked? What's great was that we were exposed in medical school to different subspecialties, pediatrics,
Yeah.
we have OB, we have surgery. So I think dermatology was something that kind of really piqued my interest. So I really got interested with getting to know more, like learning how to ask questions. So when I started residency, I was actually not sure.
Ooh.
Yeah, I was kind of am I sure? But I was already in it. That's when I actually realized, hey, this is something that I like or I love to do.
Yeah.
So it was kind of when I was already there.
Well, you were sure na. But it's nice that you started out first as the customer
Yeah.
mismo of Dermclinic, no? And then later on, you were like, so it's really nice that you got to see the whole picture of the company.
Yeah.
Yeah.
And I usually didn't like because we went on duty
Oh,
because of the medical school. So I'm actually low minded. I really didn't want to put a lot of things.
Yeah.
So I think that was something that one of the reasons that made me hesitant na do I really like this? I'm not that kikay really in
yeah.
wanting to put 10 things on your skin.
Yeah.
But I think that helped me as well because I found the value of just really understanding what skincare is.
Yeah.
Realizing what's necessary and then what's excessive.
Yeah,
So
yeah.
I'm more of focusing on that now.
Well, at least it's like this is a good time to start the questions. When you said naman about the applying 10 products at the same time, sobrang uso yung 10-step skincare products, diba? What do you say about that, Doc?
I think first you would have to know the condition of the skin because like our skin, it's actually created by God very nice na
Yeah.
it has its own mechanism to take care of itself.
Yeah.
So, meron naman na talaga siyang ganon. So, the benefit of you really knowing that is you realize that you don't really need to do too much.
Don't
but
need to do too much.
just taking care of it, like just knowing basic hygiene, just knowing how to cleanse, making sure naman that you're not sleeping with your makeup on, making sure that you're not putting too much excessive creams, diba?
Yeah.
So I think that's just knowing that and applying moisturizer when things are getting too dark, applying sunscreen. So it's really basic. So especially for those who don't who are intimidated, diba? Like they feel like, oh, I don't even want to go to a doctor because I don't want to be overwhelmed.
Yeah,
Like,
yeah.
not all doctors would do that. Sometimes, it's just the number of steps so that you try different products. But if you really are able to go to someone who can help you understand your skin, then they can help guide you.
Much
And one
better.
of the things that I like doing when I talk to my patient, I ask them what they're comfortable with. Because there are some patients who it's a habit already that when they were younger, they're already used to using a lot of
A lot of
skincare
stuff,
products. So it's okay. They can manage with like a routine.
Yeah.
But for some who are starting their skincare journey, I just recommend like 3 steps.
3 steps.
So it's easier.
What's the 3 steps that you can recommend to our viewers right now?
I think first is just cleansing.
Cleansing.
It's
So that's
just basic with soap.
Soap.
Mild soap, that's the first because normally sometimes we try to put the same old soap that we use for the body,
Yeah,
for
yeah.
cleaning. No, let's use a separate or really a facial soap if
Okay,
we
facial
can.
soap.
We prefer like a mild soap that's
soap.
non-greasy.
Non-greasy.
So, and non-fragrant if possible because sometimes fragrance can add to more irritation if you have other skin concerns.
What do you mean, Doc, by non-greasy soap? Like, parang, what are the ingredients we should check when we're gonna buy, like, a facial cleansers? Ganun?
Well, facial cleansers usually they're really basic or you can look that it's non-comedogenic. Non-comedogenic just means it doesn't cause breakouts or it
doesn't cause
prevents your
breakouts.
skin to build up ng dead skin so that hindi siya magsistay. So basically that's just it. Or it helps prevent or minimize acne. Yun lang naman yung ibig sabihin nun.
Yun lang naman pala ibig sabihin ng non-comedogenic. So, second step is...
Second step, if you don't actually have skincare problems or if is to really moisturize.
Moisturize.
Yes, moisturize. The main reason for moisturizing your skin is that normally when you go out there are a lot of things that happen. There's a lot of dust pollution that you
Pollution.
encounter. So whenever you moisturize, you kind of provide an added layer of protection for your skin.
So protection pala yung moisturizer.
Yeah, and sometimes also if you're traveling, your skin gets dry with the
Yeah.
change of weather. So moisturizing your skin at least gives it an additional boost. So that's what it does. And third is really applying sunscreen.
Sunscreen.
Yeah.
Ayon.
If you don't have any skincare problems, those 3 things are okay. Sometimes you can even go with just if you're not really prone to drying skin or you
Yeah.
feel like your skin's okay, doesn't really get affected by weather conditions or whatever your activities are, then you can go with cleanse and just applying sunscreen.
Yun lang, you can skip na the ano. But also, we are gonna be greeting our viewers. So we have hashtag Dermclinic to the rescue. Meron nang nagjo-join,
Yeah.
Doktora. So we have Alea Emmanuel. Hello, Alea.
Hi.
Ayan. So this is proving to them that we're live, Doc. All right. So we have, shout out from Dermclinic Manila.
Yeah, we have a branch in Dermclinic, SM Manila.
Yes, that's true. So now, Doc, another thing. So, diba, you mentioned about traveling. So what's your must when it comes to traveling? Like, I cannot leave the country without this.
I usually have I bring my own cleanser or wash.
Yeah.
Normally I have we have like a clear soap that we have, so that's what I use. It's non-fragrant, it's very basic, it's very mild, so it usually just glycerin because actually any soap can really cleanse your face. That's like a fact, like not because it's the process of removing the dirt. So any good soap can be used. That one, and usually a moisturizer. As I mentioned, moisturizer, I usually use a moisturizer with sunscreen already.
Already, so it's combined
Yeah,
already.
so I don't have a hard time. And I don't usually use toners if I don't have breakouts. But most commonly, I bring a cream.
Cream.
Yeah, I bring a cream which can be it helps with exfoliation, but I don't use it every day. It's like a rescue cream.
A rescue
Because
cream.
sometimes if you go to a country that's a little dry or a little too cold, sometimes your skin, our skin normally changes every 2 weeks.
Every 2 weeks. Oh, so it
Yeah.
changes.
Yeah, normally kahit wala kang gawin, that's that normal process of your skin. That's
Okay.
why if the skin follows its normal process, normally
Yeah.
it takes care of its own.
Tama.
But sometimes if weather changes, it gets affected. So sometimes instead of 2 weeks, it becomes 3 weeks.
3 weeks.
When that happens, ang nangyayari, your skin gets more dry, and then like dirt accumulates, then
it
you
build
get
up.
yes, that's
Yeah.
why sometimes people get prone to acne when they're
Acne.
traveling, when they have a lot of activities. It's not mainly because of that country, but mainly it's because of the prolonged time of
and
the change of the
exposure.
skin.
All right. Now we actually have comments that they have direct questions, Doctora. So we have one from Miles. So sabi niya, is there a specific ingredient that you recommend for oily skin and a specific brand? Ooh, that would help too.
Yeah, well, there are a lot of creams or medicines in the market, but for oily skin in particular, what I like to advise my patients, it's to use a toner.
Toner.
So I mentioned that it's not really necessary, but if you have really oily skin na kailangan mo siya i-control, there are medications, there are ingredients that help. One of the ingredients, it's salicylic acid.
Salicylic acid.
Glycolic
Spell natin yung
acid.
salicylic, Doc. Para
Basta the acids.
intindihan
I
nila.
have an easier.
Sige.
AHA and BHA.
Ayun naman pala, there's nicknames
Yeah.
AHA and BHA.
Yeah, so basically that's it. Those are the easier terms. But sometimes because it's acidic also, the drawback is it can be drying. So you really
dry.
need to look for good skin care treatment or
Treatment, yeah.
products because your skin needs to feel it. But basically the goal of that is to control your oil because oil is one of the prominent factors that causes acne.
Nako, oil really causes acne. And then I think that's the reason ba for clogging, of course.
Yeah,
then.
because the oil, of course, it attracts the dirt,
Yeah.
the bacteria that remains, and then it plugs the pores.
Yeah.
So, and then it becomes acne already.
So
dun
acne
nagsa-start.
is because of oil.
It's a combination of
Combination of
oil,
and dirt.
bacteria, dirt that nakaplug na siya. So, kung
Nakaplug
baga,
na.
bumabara siya sa pore.
Sa pore.
So, that's why what the toners do is every time you use a toner, it helps remove the excess dirt,
Yeah.
excess oil, excess dead skin.
Dead skin, yes.
So, that's what it does.
Ayan. So, Doc, do you want to plug, sabi kasi niya, a specific brand would help too. So, thank you, Miles, for asking.
Yeah.
Do you have any specific brands?
Well, at Dermclinic, we usually have our own brand. We have New Derm. It's a whole skincare line wherein our doctors really know the ingredients. I mean, the main reason why we came up with our own skincare line is because we know na sometimes, diba, there are a lot of things that people put in the products.
Yeah, a lot.
So our goal for New Derm is that it's mainly composed of active ingredients and the base. No, it's like no
active.
extenders, kung baga, sa meat,
Yeah,
ganon.
sa meat, sa
Para
food.
siyang, it's just, exactly, we just put the base,
Yeah,
a
the
very
base.
basic base, then the active ingredients. Also, our doctors are aware of the active ingredients. Like I mentioned that there are some products, of course, you can control the percentages
Yeah, you
that
can.
people put or the brands put na
Okay.
I use 2%, 5%. So what's good with our products, our doctors know. And
No.
sometimes we guide our patients to tell them, oh, this has this percent.
Yeah.
So we're able to control how much a patient needs based on our assessment of their skin. That's mainly one of the reasons.
So I really think it's super important talaga no to have your skin checked by professionals, by doctors. So ikaw, Doc, what's your secret sa skin mo?
Yeah, I mentioned that I don't really
Yeah, you
have a
don't
lot.
use.
So
Yeah.
that's why I'm also a user of New Derm. Kasi nga when I was younger, I didn't really know what to put. And then my dad was the one who actually started Dermclinic.
Yeah.
So he was on, oh, you need to use this, you need to use this. And until I got used to it.
Yeah.
And then when I was already practicing dermatology, I worked with a lot of doctors
Yeah.
at Dermclinic, and they were the ones who were even, I mean, we were testing it out together.
Yeah.
So that's why it's also good that when you ask your doctors, of course, we will not be familiar with all the products in the market. It's
Yeah.
impossible for us to try every single one.
thing, yeah.
So sometimes that's something that's hard. But this ones that we have, the new
Yeah.
derm, I try it, I use it. So it's easy for me to prescribe. It's easy for me to advise a patient because I've tested it as well.
Ooh, so we have a revelation. Doctors, try out pala products.
Yeah.
You know,
We really do. We're part of the
Yeah.
we've made it that new derm products are actually tested
By
and
dermatologists.
evaluated by dermatologists because we
Yeah.
want to make sure of the quality. And most of the new derm products that we've had are still formulations from my dad's time.
Ooh.
So the main reason that they're still here is because they're that effective. We've also developed new ones,
Yeah.
but it's really just enhancements, keeping in mind the basic principles that my dad started.
so what are the basic principles that like your dad really told you growing up when it comes to skincare and products?
I think not really something that he told me, but
Yeah.
as dermatologists, we know that a lot of allergic reactions are really with chemicals, with fragrances. So, and sometimes when patients come to us, one of the first things that I usually experience, that's why the one who wrote to us earlier, diba, she was asking for products.
Yeah,
Kasi
for
nga,
products.
I think that's one of the things that patients really ask. What can you recommend?
Yeah,
Diba? So I
actually,
think that's it. And then because we're not that confident recommending a product that's produced elsewhere, tapos
Yes.
hindi namin alam what the components are,
yeah.
we decided to kind of come up with our own.
Yeah.
Diba? With the idea na this one, I'm confident about the components. Just the trivia, I think there were some conventions that I went to before. And because I was so interested and because I know the percentages that we use, that was something that I would ask
Ooh.
the drug company. So, what percentage of niacinamide do you use?
Do you use?
And then
But-
they were like looking at me and telling me, I'm not gonna, like, are you a researcher? Yeah, because they don't
Yeah.
really disclose.
They don't want to
Yeah,
let
because
everybody
it's
know.
yeah.
Kasi
So
it's-
sometimes that's hard. Or if they say this, may mga iba pang products or iba pang ingredients that they don't tell you. They just highlight one, but you don't know the others. But what we try to do with all our new derm products is all the products that we have in here are placed there because it's necessary.
Yeah.
If it's not necessary, we're not gonna put it there.
Yeah. Also, Doc, just like some random question that I just thought of, are there special cases that parang tumatak siya sa mind mo? Like, for example, instances na nagkaroon siya ng skin asthma or super malala na skin disease or skin breakouts like that really stuck by you, and at the end of the day, you were able to help that person.
I think one of the things that really I really discovered during the pandemic was that people really tried a lot of skincare products.
Ayun na nga
So,
sinasabi.
sobrang dami. And
Yeah,
the sad thing that I realized was they would come to us late na. So, parang they would come to us in advanced stages of severe acne.
Yeah, yeah.
When I say severe, it's very red, very inflamed, and then
Ooh.
irritated. So parang, and the hard part for those patients is mas mahirap siya i-treat. And normally, there are already scars or dark spots that kind of are a little more challenging.
Meron ng mga battle scars from the past and
So
previous
that's why
products.
every time we encounter that, and then when I ask them what happened, and then they're going to tell you, oh, I tried this, and then this one, and then this one. And then, of course, we can't change the past. But
Of course, you can't change
in
it.
my mind, I was like, I hope you just consulted from the first time so that we could have guided you. Because I think that's something that we would like our the audience to know,
Yeah.
diba? It's good for you to familiarize yourself with ingredients, but
Yeah.
it's still better to consult an expert or to consult someone who can understand your skin or who studied how to take care of your skin.
Yeah.
Diba? Ask them first, or have your skin analyzed so that they can guide you. They
Yeah.
can tell you
What-
what to avoid,
what to
what
avoid.
not to use, what to apply, how
Yeah.
to take care of your skin better.
Yeah, and going back, please comment hashtag Dermclinic to the rescue if you want to be a future feature, diba? So we have a comment. So let's read that comment, Doc. So this is from Jez Rojo. So hello, Jez. So sabi, I'm sticking to using Nuderm Fluoderm Pro. So it's my go-to cream free from allergies and bacteria. And I also love moisturizing sunscreen SPF 40. So we have loyal users talaga, no, Doc? And then another thing, Doc, that I just remembered, you said kanina about having your skin consulted. So sa Derm Clinic, how much, like, do you, like, parang how much is a Derm Clinic consultation?
A consultation is at 600.
600 lang.
Yeah. So, normally, the main reason why we keep it at that price because we want to encourage everyone to get your skin checked.
Get your skin
Diba?
checked, yeah.
It's not gonna... and just imagine, some products are that cost also. Diba?
Yeah, yeah.
Pag bumili ka ng ganitong product, yun na siya.
Yes.
And then, no one... You'll just have to look at the packaging, read through it without knowing. Or you have to still search online. What does this do? So, it's
Yeah,
very hard. But
hard.
if you decide to consult already, at the beginning, we can give you an advice of your skin, what type you have, what you should avoid, how to take care of your skin.
Yeah.
Recommend habits that you should
Habits.
develop or avoid.
Avoid.
Diba? Minsan may ganon. Then, it's better. Kasi we help you through the whole journey. And I realize that as I've been leading Derm Clinic and as I've been consulting patients, that's
Yeah.
something that we want to do. We want to partner with our patients so that they can learn how to take care of their skin better.
Yeah. And it's actually, with just 600 pesos, I think it's more than just like, kasi some people, we, in our generation now, if everyone will agree, pa-thumbs up naman dyan, but they will agree that, oh, we want the solution now na.
Yeah.
But sometimes you actually just, diba, have to know what your current skin is, like yung the current state, and etc. Like, do you actually have instances like that, Doc? Na parang, akala niya, alam na niya yung skin niya.
Yeah. There are some patients who would come sometimes with their diagnosis already.
Ayan.
Doc, I have this. So, okay, I still have to check if this is really what you have.
Yeah.
Because when they search, a diagnosis comes up online.
Oh, yeah.
Right? So,
yeah.
that's the problem. But we really recommend that they consult because, the challenging thing about being a dermatologist,
Yeah.
everything looks the same.
Ooh.
Yeah, a lot of things, a lot of conditions look the same.
Yeah.
So sometimes you might think, nako, psoriasis na to because it looks like normal eczema.
Yeah.
Diba? So
Tama.
sometimes, or vice versa, you think it's just eczema.
Yes.
And then later on, there are some specific features that make it na, it's psoriasis na pala. So there's a better treatment.
There's
So,
difference.
yeah. So, but it takes really a skilled eye to check it. So, minsan, kapag if it's just your first time and then you're assessing your skin, you won't really be able to know the difference.
Tama, that's true. Doc, speaking about eczema, we have a related question. So that's from Kyle Nazareth. Can you read it, Doc?
Where is it? Sorry,
There,
I
the
can't.
color blue one. So it says, "Hi Doc, my son has eczema. What can you recommend to get rid of it?"
For those with eczema, since he didn't mention how old the child is, right?
Oh yeah, Kyle, baka you can comment.
But
how old.
mostly for kids, it's common. Kasi from birth, especially babies,
Yeah,
it's very,
babies.
very common because their immune system is just developing.
So it's
So,
common. So it's really nothing naman to really worry about, or
Unless it's persistent.
Ooh, what do you mean by that, Doc?
Ibig sabihin, when I say persistent, if 2 weeks na and then it's still there, then there's a need for you to consult already.
2 weeks.
For Kyle, for his kid, one thing that he can do is really apply. Eczema appears mainly because there's irritation, there's inflammation, and sometimes because of dry skin. So one of the first things, first aids that you can do is really apply moisturizer twice a day. That's a basic reminder for by dermatologists to apply moisturizers twice a day.
Twice. So, let's debunk that one. Kasi madalas nakikita natin, ayun, he's 2 years old, Doc.
Yeah, he's very young. So, I've had patients like that. Another one was a son of my friend.
Oh,
so
yeah,
they
yeah.
came to me for a long time. So, it's mainly because there are risk factors also. If, for example, meron pong hika yung parents.
Oh, yeah.
If there are family members or if you have a family history of allergic rhinitis or meron din yung sinabi ko kaninang skin asthma,
Yeah.
minsan pwedeng mapasa sa kid.
So,
Genetics.
genetics.
So, sometimes the kid can have very hypersensitive skin.
Hypersensitive.
Yeah, so you can have it consulted, but the first thing that I could advise is really apply moisturizer twice a day or shift his creams or his soaps to something that's very mild. Really, for baby wash or baby lotion, you should use that so that his skin will be protected. If, for example, you tried to do that but it still doesn't improve, we can also try to avoid those food that causes allergens.
What are the food that causes
Yeah.
allergens?
Egg,
Egg. Chicken.
So, yeah. Seafood. So,
Nako.
I'm not sure kung ini-introduce. If it's 2 years old naman, hopefully, we're not sure if
That
it's
can be the
already
cause.
eating table food. But hopefully, if it's eating table food, or sometimes, there are children who are very, very sensitive even to processed milk. Like even the powdered milk. So sometimes you have to also consult with your pedia. Baka mamaya you have to shift the kind of milk that you
they
might be giving.
drink.
If he or she is not breastfed.
That's actually very insightful. I didn't know that meron palang effect yung ganon.
Yeah.
Oh, that's another thing, Doc. Because we're talking about eczema, I remember my sister, actually everyone in our family, we went through eczema at one point. And then we searched so much things to get the solution. So there's oatmeal, there's using goat's milk, lahat na lang ginamit para i-medicate yung self-medication.
Yeah.
So what do you think about like self-medication?
Well, as I mentioned, because there are factors that cause a rash, diba? So,
Factors.
sometimes, pwede naman siya that you can do for immediate relief. Sometimes, our patients, we recommend also to apply cold, diba? Kasi the cold masks the itch.
The itch, yeah.
So, it doesn't necessarily resolve it, but it can help. But as I mentioned, if the rash may persist more than 2 weeks,
Yeah.
better talaga mapatingnan nyo. Kasi, if it lasts longer than 2 weeks, pwedeng kawawa din yung kid kasi if he or she keeps
Yeah.
scratching, minsan irritated siya sa gabi, baka mamaya.
Exactly.
Oo.
Yeah.
And sometimes, especially for Filipino skin, our skin is very prone to darkening. So, minsan,
Ooh,
yeah, pag
oo nga.
ba't biglang nangitim tong,
Area,
it's
that
because
part,
of
yeah.
previous rash na hindi na-treat, hindi na-manage. So, it's better that they see a doctor
Yeah.
early on to be treated.
That's true. Sabi ni Kyle Nazareth, noted daw, Doc. Thank you. And ang ganda mo daw. Of
Thank
course,
you.
guys. Maganda talaga si Doc. So, we have another comment actually. Doc, possible ba ang minoxidil gamitin for alopecia sa beard? Ooh.
Yeah. Actually, it can be used. Minoxidil, 5%. It's safe to use twice a day. Again, a lot of dermatological
5%.
creams or medications, we usually recommend it to be used twice a day.
This is okay for facial.
Yeah. But you can use it I went to a conference in India one time, and then if you look at their culture, they want people na very manly, yung talagang complete. So actually for them, they really put, like there's really exclusive use na, not just for the hair in the scalp, but also for the beard. Kasi that's part of the culture. Here in the Philippines, of course, hindi naman lahat ganon. So, but it can be used. I think one thing that I can recommend lang is make sure that you use a dropper so that at least you avoid other areas.
Oh,
diba? Kasi
okay.
we want to keep it concentrated dun sa area kung saan mo siya gusto i-treat.
Okay. Did you hear that, Patterson? So, pwede naman pala gamitin yung regrow minoxidil sa face as long as mayroon safety and
yeah,
safety
but
way.
use it gradually. If you've been using minoxidil for a long time, then it's okay for you to use it. Kasi ibig sabihin. But if, for example, medyo hindi ka pa nagtatry at all. You haven't used minoxidil. It's better for you. One thing I recommend is not just for minoxidil, but any cream or any treatment or any product that you buy online na it's going to be your first time to try. Try to apply it once a day first, just to see for the next 3 days. Or sometimes, some doctors would recommend, put it in an area wherein it's hidden. Kunyari, under the ear, diba? So that you can observe if your skin's reacting. Kasi sometimes, of course, different people have different reactions to medicines, and not all manufacturers would know which you're allergic to, which you're not. So that one is one easy way so that you won't get irritated skin and then after mag-acne, magpa-mark. So that's one way. Make sure that you try to observe it for the next 3 days. If, for example, it looks okay, it looks like your skin's doing good, then you can try using it at least for a week. Then, if it's supposed to be used twice a day, then after that week, then you can start using it twice a day.
Ayun. So, we gradually do the process. But at the same time, important nga to do a patch test, right?
Yes.
Doc? So, to know if there's
but sometimes
allergies.
yun nga, they don't really have. Sometimes it's the doctors. You have to go to a doctor to get a real patch test.
Oh, a real patch test.
So, yun. If sometimes you don't have that access, one quick way is just get a small amount, apply it in an area wherein you can observe, diba? And don't mix new products. Kasi sometimes, if you're allergic to one and then you place them together, you won't know which you're allergic to.
Okay, yeah, that's true. And in line with that, Doc, diba? Parang kanina you've been hearing us say go to your dermatologist, your trusted dermatologist. What can you say, Doc, to the people who are intimidated to go to the dermatologist? Parang, syempre, they know na it's the hospital, etc. It's scary.
Yeah. Well, we already know that that's gonna happen. That's some of the concerns that I know. Kasi aside from seeing patients na ganon, diba, they come at a latter stage. Sometimes people are intimidated in terms of the cost. They're intimidated because they feel like they're going to be charged extra. So for me, what I usually recommend with them, I mentioned the New Derm. So we've made New Derm since the pandemic. We've made New Derm available online. So actually, if for example you're looking for a product that you want to try, you want to test out, we have placed like very clear how-tos. We've recommended this one's for oily skin, this one's for everyday use. Then they can try out.
Ooh.
Yeah, that's one way. If, for example, you feel like it works with your skin or you want to know more, then that's a time that you go to a doctor.
Okay.
Diba?
Yeah.
Or if you still have questions, you still don't want to talk to a doctor, diba? You can, kasi diba, sometimes we find ways. You can try to send us a message on Facebook. So if it's just a basic question about the products, hopefully we can answer you. Or on the online stores, usually we have someone answering basic questions about the products if you're intimidated by it. Or if you're near any Dermclinic branch, I think that's the best. Even if you don't immediately schedule a consultation with a doctor, you can talk to our branch managers, you can talk to our pharmacists, because we've equipped our clinics to have like full-fledged medical personnel who understands the skin, who knows how to take care of you, who knows the product. So even if kunyari it's just a basic ano yung okay for oily skin, yung anak ko ganito, then you can consult with them. But if for example it's really a condition na ay yung rash nito matagal na, syempre hindi naman pwedeng mag recommend na yung branch manager or yung pharmacist. It really needs a consultation.
You need to trust your doctors, actually. So guys, again, we want to reiterate the importance na kailangan nyo talaga to visit a doctor, which is a dermatologist. When it comes to, you know, if you have a skin problem, guys, it's only 600 pesos because before maging malala pa, right, Doc?
Yeah.
And we also have another comment. So, another question. So, this is from James Rosales. Doc, pagpapalit-palit ba ng skincare, masisira yung face ko? Hindi naman masisira yung face niyo, sir, guys. Hindi po masisira yung face. Yeah.
I think it's more of hindi makaka-adjust yung skin mo with the new regimen. Diba? If you really want a product to work, you have to wait for at least 2 weeks to a month to see results.
So, 2 weeks to a month of using that one. Yeah.
So, with skincare, with taking care of your skin, it really takes patience. A lot of patience.
Patience.
Yeah.
Keyword. Hashtag patience talaga.
Yeah. And as I mentioned, the main reason is because our skin changes every 2 weeks. So, yun yung susundan mo. You're just gonna have to follow the pattern of how your skin adapts.
Yeah.
So, normally, I would recommend to not use na papalit-palit. If, for example, but if you have, for example, feeling mo biglang pinimple ka this time, and then you don't know which, the first advice actually that doctors normally give their patients is to stop everything.
Ooh.
Yeah.
Drop everything.
Yeah. Kasi if you're not sure which among those products caused your skin reaction, or if you've eaten anything, then we have to find out the culprit. Diba? We have to find out sino yung may sala. So,
That's true.
So
Talking about
what we do, we usually recommend our patients then to slowly reintroduce. For example, if you came to my clinic and then you had like, Doc, I've used this. Diba? What I'm gonna do, ask you, is just mainly stop everything. And then what I'm gonna recommend, maybe a basic cleanser. If it's in your regimen, then I can recommend that. But if sometimes you've used very, very strong, like I have nothing against rejuvenating sets, but sometimes minsan pag na-over, matapang. And sometimes I think it's also because of we want results agad, diba? Sometimes we overdo it. Diba? I think we're all guilty of that na if you feel like this is effective, you're gonna put 2 times of the required amount.
Instant glass skin. So, kailangan na talaga yung rejuvenating. Kasi it's how they market it too. So, that's, I think also, Doc, when you mentioned about kailangan gradual and when it comes to picking the skincare, what are the ingredients that besides kanina you said AHA and BHA, right? But for you personally, what's your favorite? Na you can tell everyone na, oh, when I see this, it's an immediate buy.
In moisturizers, what I like to use is really with ceramides.
Talagang ceramides.
Kasi it's mainly for hydration. So, as I mentioned, my skin's more on the drying side. So, I really like using it. And usually, there are a lot of ingredients that are good to use on the skin, but it can depend on your skin concern.
Okay.
So, depende kasi siya eh. Like, because sometimes if you use anything that you use too much of, can be harmful then for your skin.
Very harmful.
So, normally, what I recommend, there are good products. There are good combination of products. Siguro one thing that I would recommend, if, for example, you have a brand that you like, try to use a similar product or partner. Kasi sometimes these brands or those manufacturers, normally, they mix and match now what goes well.
What goes well,
But
tama.
the problem kasi, if you try a soap from another brand and then you get a moisturizer here and then you get a toner here, like we haven't tested that. Oo.
It will jumble up
Oo.
together.
Baka mamaya,
Yeah.
this has salicylic or this has acid, and then this has another acid, and then you combine those two acids, it
Yeah.
might be too strong.
Too strong. That's true.
So,
And-
the best thing is if you have like a mild, usually that's something that your doctors can advise you, your
Yeah.
dermas can advise. If you use a mild soap, I usually recommend mild soap. If
Mild
there's nothing wrong with your skin, you use a mild soap. If you want something, treatment that's really for dark spots or anything, you can use creams.
Creams,
So, make the soap more neutral, make
Yes.
the moisturizer more neutral, then you add creams or toners that would be effective
Oh.
against your concerns. So that way, you won't get too irritated
Yeah.
with a lot of products. May pang balance ka.
May pang balance. Thank you so much, Doc. So next up we have, grabe Doc, we have so much questions. So an influx of questions now. So we have from PJ, how do you deal with scalp psoriasis due to stress related? You know?
Yeah. So if you have scalp psoriasis, I'm not sure if you also have psoriasis then in other parts of the skin.
Yeah.
Normally, with psoriasis and other types of inflammation, ang main problem dyan, mataas yung irritation level. So, kailangan mo siyang i-bring to a normal level. So, normally, what we recommend is really a week of using antihistamines,
Antihistamine.
a week of oral, mostly.
Yeah.
We combine oral medication and topical.
Oh, okay.
Topical, meaning po yung pinapahid. And then oral naman, yung iinumin. So normally, I recommend an oral. And then I recommend naman yung pahid, which is moisturizer.
Yeah.
As I mentioned yun, mga eczema, normally because of hindi napapalitan agad yung skin. Sometimes applying moisturizer
Yeah.
with an active ingredient helps to improve the skin turnover.
Okay.
So, yun yung recommendation ko. We usually recommend steroid creams at a low percentage, and then it has to be applied very thinly and then with the advice of the doctor. Sometimes, we also recommend an anti-dandruff shampoo that you can
Ooh.
use.
So that's actually like
Kasi it's scalp
connected.
psoriasis eh.
Ah,
Diba? The
okay.
one that he mentioned. So, normally, yun. And then we keep it. If, for example, that's the first level of treatment that I usually recommend. I don't wanna mention the creams because iniiwasan pa rin po nating mag-self-medicate.
Yeah,
So
that's
it's
true.
really beneficial if you have a doctor that you have consulted or who diagnosed you with scalp psoriasis. Better to ask. If, for example, wala pa, you can go to the nearest Dermclinic that you can visit so that we can help give you an advice. We also have
Yeah.
products that we use that are exclusive lang inside the clinics. You can't really buy online kasi they should be prescribed by a doctor.
Ayun. So, before, that's true with what Doc said, before you diagnose yourself with scalp psoriasis or na-diagnose na kayo, it's very important to have it checked also. So, again,
Kasi we have to check
consultation.
first kung if it's in flare or if
Yeah.
it's not in flare.
Yeah.
Ibig sabihin ng in flare, kailangan mo talaga siyang i-control.
Control.
It's kind of wild, ganoon. 'Di ba?
That's
Merong
true.
yun yung tinatawag nating parang lumala siya ngayon.
Yeah,
'Di ba?
yeah.
Sometimes that's how we describe it. Before okay naman, biglang lumala ngayon. So
Tama.
that's what we call in flare. So normally you need to consult with your doctor so that they can tell you how to control that. Then you can treat it gradually. For psoriasis, it's really a chronic condition. Ibig
Yeah.
sabihin ng chronic, it's a long-standing condition. So, dapat mini-maintain mo siya. So, for those with skin conditions like psoriasis, atopic dermatitis, dapat po talaga sana meron kayong doctor
Doctor.
that you can run to. You know, one thing that we do with Dermclinic, because we really encourage consultation. If you consult with us, and then we know that, of course, some conditions last long.
Yeah.
Alam mo yun, sometimes hindi yan nawawala ng agad-agad, especially if it's a chronic condition.
Yeah.
We allow them to come for follow-up a week after for free.
Oh, wow.
So, ibig sabihin,
That's
as
very
long as you
generous.
consult now, di ba?
Yeah.
We give you medicines, you follow that through, because we want to see you again. Diba? We don't
tama.
want people, one of the problems of doctors, honestly, is having patients lost to follow up.
Yeah,
Diba?
tama.
Kasi ayaw mo nang bumalik kasi babayad na naman ako.
Oo,
So that's why
true.
we made it na no, because we really want to see you improve, if it's the same concern,
Yeah.
if you come within the next 2 weeks, then we follow that up if it's the same concern. Pero syempre, if yung una mong concern is scalp,
Yeah.
'di ba? Tapos yung kasunod mong concern,
Skin.
oo, iba
Ibang
na.
usapan na yun.
Oo. Syempre, kailangan nating malaman what
Yeah,
happened.
That's true. Another comment, Doc, it says, "Hello, Doc, do you have a niacinamide serum that we can buy on like over the counter? So is it safe or advisable to use for a first timer?" Ooh, so
Yeah.
first timer.
Yeah, we have what you can see online. You can check our shop in the Clinic PH.
Yes.
Normally, most of what's available there is safe for normal skin as long as you don't have any other conditions. If, for example, Luis and I were talking about some, di ba, parang, paano kung kunyari, parang nag-better naman yung skin. There are some creams that even if it's not prescribed, it's generic,
Yeah.
but it can work best with your skin. We have serums. We have 4 different types of serums, if I'm not mistaken. One has niacinamide, mainly for acne. Another has specific for collagen renewal. Another for anti-aging. So, you can look at it. Yun nga, we know that there
yeah.
are other concerns, so you can use it. How do you use serums? Usually, I also recommend serums twice a day for
Ooh.
best effectivity. But yun
Morning,
nga, siguro for the first time, if you've never used serums, you're not used to skincare, try it once a day muna for the first week, for the first 3 days. If it seems okay, then you use it constantly for a week,
Nice.
up to
if
2 weeks.
The first time is at night. Best yung applied at night, yeah.
And don't overdo it. That's really something that we keep reminding our patients, diba?
Don't
If
overdo it.
Yeah, most of our creams come in 30 ml or up to 100 ml.
Yeah.
30 ml usually, you'd see, kaya siya ganon kasi it's good for a month to 15 days to a month.
Oh, wow.
If it's once a day, then it's good for a month kasi
month,
it's
yeah.
31 ml at least per day. If it's twice a day, then you can use it ng for 2 weeks.
2 weeks.
Yeah, but use it slowly, 'di ba? Don't expect results agad, especially with skincare, especially with acne.
Oh,
Acne
okay.
is a condition na you have to manage inflammation, you have to manage the oiliness of your skin, you have
Yeah.
to control bacterial infection, you have to. So medyo marami siyang kailangan. So don't be too aggressive. Don't also try to prick your pimples.
I was, sorry, I'm guilty. Guilty as charged. Kasi I was asking Doc kanina, Doc, what do? I always prick my
Yeah.
pimple. When I'm bored, when I'm anxious, when I see it na, I prick it na.
Yeah. One thing that, well, I think it's innate because you want to control. You want to have something to do with it because you feel like
Yeah.
if you're not doing anything with it, alam mo yon,
Yeah.
it's a must.
It's a must.
But what I recommend is to remind our patients that our hands are not really clean.
Ayan, guys.
Diba? Our hands are not
Hands are
clean.
not clean.
So, every time you go to a doctor, it gets treated. We have a whole set. We have gloves. We have equipment
Yeah.
that are sterilized. So, imagine, yung lahat ng yan, pinapalitan mo with your hands na
Tama.
hindi malinis. Tapos, may infect. So, that's
Yeah.
one of the problems. And, another problem is that sometimes, if you don't do it correctly, because as I mentioned, pag Filipino skin, marami tayong melanin. Ibig sabihin, mabilis tayong mangitim, 'di ba? So, mabilis tayong mag-dark.
Dark
So,
spots.
ibig sabihin, kapag na-irritate yan and then you did it wrongly, possible, automatic ang effect niyan. May dark spots.
So for Mac, so relate tayong dalawa. Bro, kasi talagang sabi niya kasi, Doc, paano po matitigil yung habit ng pagpuputok ng pimples?
I think just, for if it's really, sometimes kasi sobrang madami, what I recommend, mostly, if it's really to control infection and the doctor assesses na medyo, if it's more than half of your face,
Ooh.
diba? That's when I really recommend antibiotic, oral. We have also antibiotic in the clinic that's topical,
Yeah.
pero it has to be checked and recommended by the doctor para hindi ma-over.
Nako, Mac, kailangan natin tigilan talaga kasi or else it will lead to even greater skin issues. So, we don't want that.
Yeah. Or, yun nga, if you're using, if for example, you really have acne, my advice is you use a cleanser, as I mentioned earlier, use a toner, and then a moisturizer. The toner should be the one with active ingredients. So, you can use that as baseline. But if, for example, tinry mo na to ng 1 week, wala pa rin. 2 weeks, wala pa rin. Pa-consult ka. But if kaya siya ng ikaw yung nagmamanage, 'di ba? Do it for 2 weeks. Make sure na you have a toner. Sometimes a serum also helps.
Yeah.
So toner and serum yung active ingredients mo. Then you have a special basic lang na soap at saka ng moisturizer.
Okay. Oh my goodness, Doc. The time is like, we are enjoying over here.
Yeah.
So, we have like 20 minutes left. So, already na ba tayo mag-speed round? Kasi, I bet, ang dami nating comments. So, it says, Hi, Doc, Angela, and Luis. Uy, nasama na ako. What treatments should I try when I have pitted scars? Ooh.
Pitted scars. So, pitted scars, yan po yung scars na parang ice pick. Yung parang malalim.
Malalim.
So, pwedeng meron yung pimple before or may scar or may infection before na nung nag-heal, halos kitang-kita mo siya. And the problem with that, malalim siya.
Yeah.
So, there are treatments that clinics recommend. There are peels that are recommended. Usually, ang peels that I recommend, it's TCA peel.
TCA peel. Okay.
It's an acid. So, it's trichloroacetic it's TCA. So, yun siya. But you don't need to remember it. But if you go to a doctor, they know what it is. They know how to use it.
Yeah.
There are some, I think, one thing that I can advise. There are self-treatments to use dermal rollers.
Oh, dermal rollers.
Yeah, don't use it, ha? Kasi, don't. Kasi yung bibilin nyo lang, tas kayo it doesn't really help pitted scars. Pitted scars are one of the hardest scars to treat kasi para siyang ice pick.
Yeah,
so, di ba pag ice pick, malalim.
Super
so,
lalim na,
it won't really be effective with, even if you try doing a DIY. It's not gonna be effective. Better to consult kasi there's a way wherein we try to revive your skin. We try to stimulate collagen production using acids. But it has to be in a controlled environment. Otherwise, masusunog kasi yung skin. That's why you really have to know a doctor who can do it for you, who can do it in phases.
Yeah, tama. So, again, for Miles, you have to visit your nearest Dermclinic branch. So, next. Hi, Doc. Does lifestyle change cause dry or oily skin? Lifestyle change?
It can. Like, one factor for oily skin is, that can contribute, to oily skin, is staying up late. So, that's part of lifestyle. Like, for example, if you've shifted, diba? Why? Because staying up late actually keeps your oil glands more active.
Ayan.
So, if puyat ka, puyat din po yung oil glands natin. So, nag-overtime din siya.
Yeah, parehas na yung nag-overtime. So, nako, halatang halata na oily skin is because I'm staying up late too.
So it can, not necessarily that lang, but there are other factors. But if you do, like there are some who shift their work hours to overnight. So, pwedeng may effect yon. The initial changes or pag nagpupuyat, diba? It can be a factor. But there are ways to minimize or manage. As I mentioned, yun nga, yung change in weather, change in habits, ang nangyayari, yung 2-week dapat na development ng skin mo, pwedeng na alter.
Oh.
So, that's why we usually recommend na sabayan mo siya with a good skincare regimen, and then you apply good creams, exfoliating creams. But one caution lang with exfoliating creams, I don't really recommend it every day, especially if very, very potent yung ingredients. Pag potent yung very effective, kasi minsan, baka ma-irritate naman ng sobra. So, normally, I recommend every other day.
Every other day. Noted. All right. So, we have our next question from Jeff. So, may ideal skincare products or treatment din po ba for men? Ooh.
Yes.
Yes.
Well, actually, wala naman talagang major difference
Oh, no
yung
major
men
difference.
and women na skincare. Kaya lang minsan, it's with a preference. Like,
Okay.
women like to do...
A lot of things.
Yeah. Diba?
That's true,
Minsan yun
that's
lang yun
true.
eh. Men like things simple.
Simplified.
Soap, toner, and then that's it.
Actually nga, Doc, minsan soap lang tapos
Oo,
diretso
ayaw na.
yeah.
So yeah, yun. Kaya it's usually what we do with our consultations, even the doctors that I work with, what we really recommend is we ask what you like, how, alam mo yun, what's your usual regimen? Para yun yung sasabayan namin. If for example, you're someone who's minimalist, you can't keep up, diba? Because for us, that's our premise. If I give you a 10-step and you're not even gonna follow it, sayang.
Yeah.
It's better for me to just give you what you can go with. If you can go with just 2 steps, then we stick with 2 steps and then make it effective.
That's true. That's nice, Doc. So it really adjusts per person. So next comment we have from Mac. Doc, question for my brothers po. May chance po ba bumalik yung hairline nila? Like pills or something?
Yes. Yun nga. As I mentioned, there's what we call male pattern alopecia and female pattern alopecia. So sometimes, if yun yung klase ng alopecia that you have, it's genetic. So pwede siyang namamana. If your parents have that, the difficult thing is you can have that early on. But there are treatments that can be done. There are topical lotions, which is another is the minoxidil.
Yeah.
Minoxidil 5% twice a day. You can use that. Usually, kung sinasabi ko kanina sa skincare, it takes 2 weeks to a month.
Yeah.
Ito lang medyo matagal. It takes minimum of 2 months.
Yung sa hair. It really
Yeah.
takes... Oh, Doc, bakit matagal?
Kasi, aantayin mong mag-react yung tubo ng hair. 'Di ba? So, galing pa siya sa ilalim. Our skin's already on the surface, so 2 weeks. But it's
Okay.
galing inside and then you
Yes.
have to stimulate it. So, you have to give time for the medicine to be absorbed.
Okay.
It has to revive the hair strands.
Yeah.
So, mas matagal siya. So,
Yeah.
minimally, it takes 2 to 4 months
Okay.
for you to see results. If it's really a concern for you, there are treatments that you do inside the clinic that can speed it up.
Oh,
There are
okay, there are.
micro-needling treatments. There are light therapy. We use photodynamic therapy, iilawan.
Oh,
Meron
okay.
din naman that's a combination of massage. We actually have something like a hair shawl in Dermclinic.
Yeah, hair
Yeah,
shawl.
so
Sa shawl.
hindi lang face ang kailangan, 'di ba? It's
Also
also the
hair.
hair. Yeah. So what we do a massage, a basic massage. We apply the creams and then we
Yeah.
teach you how so that you can apply minoxidil afterwards. So yun, medyo matagal lang siya, but there are.
There
If for
are.
example, you did this for a couple of months, wala talaga. The last resort is hair transplant.
Ooh, yeah.
So, but
Hair
mostly,
transplant.
we've seen a good number of patients who get good results with just minoxidil alone.
Alone.
Also, better results with minoxidil plus other treatments in the clinic. So, you can just easily get that result as long as you have someone to consult with, and then we can guide you with what to
How do you-
avoid.
yeah, what-
Normally, the basics that I tell our patients, don't wag makulob. We know that we sometimes want to hide it.
Yeah, yeah.
So, but wag nyo rin kulubin because sometimes if you always wear caps, nakukulob din yung...
Oh, yeah, that's true.
So, we need good circulation for it.
So again, guys, kasi super daming mga comments niyan, Doc, na ang tagal naman. It's matagal because it's really the pattern of our body. So,
Yeah.
yan, guys, let's be patient. So, another question asked, where do they buy regrow minoxidil? Over the counter lang po ba? Or do they have to go to the clinics?
Regrow minoxidil, the 5%, which is available naman.
Yes.
It is available over the counter. It's
Yun.
available in Mercury and Watson's and your leading drugstores. So you can
Yan.
ask for it there.
Yes.
But there are also online.
Yes.
Pero if you need something a higher dose of minoxidil, is a step-up regimen is the minoxidil 6%. That one you really need with consultation.
Yes.
Kasi if you've been using minoxidil 5% and it's not working, then the doctor usually asks more questions. The doctor may recommend that you do blood tests just to make sure na wala kang ibang concerns.
Ayun,
diba?
wala kang ibang concerns. Thank you, Doc. So next is, good evening, Doc. What ointment will you recommend for like when you get your warts removed? So for fast healing.
For warts, normally, how that's treated, it's electrocautery. So, susunugin. Because warts are viruses.
Warts are viruses.
So it can be passed
I
on.
didn't know that.
So, kailangan mo siyang sunugin. Bawal mo siyang kutkutin.
Okay.
So, what really works is, the first step is really, don't pick on it. That's the number one.
Don't pick on it.
Kasi
Yeah.
pag pinik mo siya, ang mangyayari, magsascab. Magsusugat. Diba? Kasi when makikita mo yan, mangingitim eh. So, normally, ang recommendation, it's really a moisturizer. I told you, it's kind of common for me to keep recommending a moisturizer para hindi mag-dry. Kasi the more na mag-dry, mas mabagal yung wound healing. So, you need the moisturizer just to keep it. And then, hopefully, within that week, sana wag ka munang mag-expose na mag-beach.
Ayan.
Diba? Kasi mag-iiba agad yung yung sunlight, maapektuhan while it's healing. So, and apply sunscreen.
Moisturizer and sunscreen for
Sometimes, for a few days, we sometimes recommend then a very, very mild steroid cream just on the affected areas.
only in the one na natanggalan ng
But it
swart.
has to be just for a few minutes. But for steroid creams, usually I also recommend to consult with your doctor. Alam mo,
Ayan.
these creams, they're available over the counter. But the
Oh.
problem kasi, if you overdo it and then you don't know how, it can have side effects wherein mamumuti naman siya. So that's why sometimes for skin conditions, dapat talaga alam nyo how to use your creams, alam nyo then how long you should use it para hindi siya ma-over.
Okay. Noted. Doc, to stray away from the creams, we have a question from Shobe na it says, does bio oil really help to lighten PSOR scars? So I don't know what PSOR scars. What does that stand for?
Source.
So,
Or
sorry.
baka psoriasis?
Saka psoriasis. Yeah, tama. That's true. Yeah.
Is it?
Yeah, psoriasis.
So,
Bio oil.
well, oil in general works similar to a moisturizer.
Oh, okay.
Diba? It's just oil-based. Mas thick siya. It can help with stretch marks. It actually helps. It's not really. It helps moisturize your skin. Diba? But
Okay.
it cannot really stop it if there's irritation already. Diba? So, yun lang.
okay.
It can improve. Pwedeng mag-lessen yung pula. Pero
Okay.
hindi siya totally makaka-treat.
Yeah.
Kasi I mentioned nga, sometimes you might need really a medicated cream.
Yeah.
So, yun lang. It can help even with, sometimes oil is also used kapag for women who are pregnant. Diba?
Yeah,
Tapos ayaw
yeah.
nila magka-stretch marks.
Yeah, I
So,
hear
what they
that
usually do, increase applying moisturizer. Kasi nga, as your skin stretches, pag dry yan, nagmamarka agad. So, when you frequent the use of moisturizer, it helps make it more stretchable. That's the value of the oil.
That's why. Okay. So really moisturizers over oils. Okay.
Well, it can be together. Kaya lang, 'di ba, the problem lang with oils, if you use it particularly in the face,
Okay.
lalo na in our temperature, in
Yeah.
our environment, it's
Super humid.
It's
Yeah.
humid. So, that's just the problem. But if you can endure it, then pwede. But
Pwede.
if it's acne prone, the area is acne prone, yun lang, it can
Yeah.
also trigger acne.
Acne. Okay. Thank you, Doc. So we have, guys, just a quick break. We have 2 questions left. And again, para makasama kayo sa raffle namin, make sure to comment. What are you gonna comment, Doc? The hashtag.
Dermclinic to the rescue.
Yon. All right. So, last 2 questions. So, this is from Ico De Leon. Doc, minsan kasi nagfa-flaky yung face skin ko. Tumor na sa bandang kilay. So, bakit po kaya and why does it happen and anong dapat gawin?
If it's nasa kilay, most commonly, it's seborrheic dermatitis.
Seborrheic
Sorry, kasi yung mga medical terms talaga, marami
Yeah.
talagang itis. So, pag
itis.
nakarinig kayo ng itis, ibig sabihin, dermatitis, diba? So,
Yeah.
more or less, it's a skin condition, it's inflammation. So, normally, it's an inflammation of the oil glands. So, kaya siya ang area kung saan din tayo maraming oil is eyebrow, kung saan may buhok. So, usually yun. And minsan, in the mustache area.
Oh.
So, what you can do with this one, there are anti-dandruff. Kasi sometimes, pag meron ka rin sa face, pwedeng meron ka rin sa scalp.
Oh, okay.
So, usually, we recommend anti-dandruff shampoo. There are also soaps that can help control the oiliness. So, one thing that you need to do for that is really control the oil. Kasi, dun siya nanggagaling. And then, another is to again use antihistamines. Madami ring treatments for skin concerns na normally, nagre-recommend talaga kami ng use of antihistamines.
Ooh.
But, siguro, a reminder, when we recommend antihistamines, we don't recommend it once lang. We
not
recommend it that you use it for about 5 days to a week.
5 days to a week.
Because normally, pag ito yung normal skin natin, when your skin is irritated, ang nangyayari, nagfe-flare siya. So, you need to bring your skin back to the normal level. So, kaya, it usually takes a week, scientifically. That's why we recommend it na matagal. So, that's why, di ba sometimes kasi for us, I think, what we commonly do, may allergy ako sa food. So, I'm gonna take antihistamine. Tapos after, titigil ko na. But normally, if you really want to manage your eczema, manage your skin concerns, we really recommend treatment that's a week.
So talagang it's really being consistent and being patient. I think really when it comes to skin and hair. Yeah. So last question. And the last one belongs to Jumon Kim. Naging Korean ako bigla. So, good evening po. My 2-year-old baby always gets bitten by mosquitoes. Yung mga peklat po ba, mawawala po ba yun?
Yun. As I mentioned, yun nga, possible talaga yan because of the environment. And sometimes for kids pa, mas sila pa talaga yung natatarget kasi wala naman silang defense. Or sometimes they also do not scratch it. Yes, it can be resolved, but I recommend because for kids, it's uncontrollable if they itch. Yun yung number 1 kalaban. Possible na kaya siya nag-mark na kasi paggabi, 'di ba, while you're sleeping, they keep scratching.
Oh, yun.
So, there are creams. If you use aloe vera creams that are cool for the body, aloe vera gels, it helps. Kasi sometimes, 'di ba, with kids, we don't want, and I think parents would agree, kids don't like to use moisturizers, lotions, they don't like it. Diba?
I think growing up too, I don't like that.
They like something more of gel kasi malamig. So, you can teach kids, not just for 2-year-old, but for those in preschool, you can teach them that if you have a rash and it's itchy, what you can do is just apply a gel or palamigan. Or you just ask them to tap. Kasi nga, it's an itch-scratch cycle. There's something in dermatology that we call the itch-scratch cycle. So, if it itches, sa scratch mo.
Tama.
So, it's a cycle. So, uulit siya.
Uulit lang. Yeah, that's true. So, ayan. I hope we answered your question, Jumon Kim. So, I just wanted to say her name once again. Pero, Doc, did you enjoy this?
Yeah.
You did?
Yeah. It was fun.
It was fun. I think parang magsa-start na ata tayo ng podcast, Doc. All right. Anyways, so guys, now it's time to choose a winner. So, again, thank you for commenting the hashtag Dermclinic.
To the rescue.
To the rescue. So, ayan. So, again,
we will choose 5.
5, yes. 5. So, if you are the winner, you have to comment present. So, dapat present kayo now. Ayan. Alright, so we will flash it on screen and then tune in for the randomizer. Ayan, let's... Doc, would you like to say go?
Okay. Go.
Ayan. Alright, umiikot na yung ruleta natin. Ayan, so we have... I'm so sorry, I cannot read it na. So for our first 1,000 pesos winner ng GC is... Doc, can you see it?
Not really.
Ayan. So for the first winner, we have...
Is it Annalyn?
Ayun, we have Annalyn Guzman. V. Ang haba ng pangalan. Annalyn V. Congratulations. Make sure to comment present, Annalyn, para we're making sure na you receive this and you're here. Ayan. Andito po ba? Ayun, nagparamdam. Alright. Doc, say go again.
Okay. 1, 2, 3, go.
Ayan. So the next one. We have
Christine?
Yon, we have
Christine Concepcion.
Congratulations. Do we have Christine Concepcion in the comments? For a moment. Oh, we're gonna spin one more time.
Okay.
Okay, go ahead.
Okay. 1, 2, 3, go. Okay, it went ahead of me.
Next, ang ating mahiwagong ruleta, we have... Ooh, one of the people who were asking questions.
PJ.
Congratulations, PJ. Next one. Ayan. Sino kaya? Ayan, Doc.
Tuesday, and then siya.
Ayan.
Oh, Doc Tuesday. She's one of our doctors.
Yes, Doc Tuesday. Thank you for Wow, meron siyang incentive, Doc. Congratulations. Ang cute. I-wave na lang po ba? Hindi, tuloy natin. Alright. For our last...
So if you're in the South, maybe you might meet Doc Tuesday.
Ayan.
So,
if you're in the South, yan. Our last winner... Uy! Our last winner is... my favorite name for this live. Jumon Kim!
It's your turn to shine.
Thank you.
Say his name.
Ayun. So,
A reminder pala for, he mentioned like if you can treat it. So, for kids, yes, it can be treated. But sometimes, diba, for kids kasi na 2 years old, I don't really recommend na treatment muna. Better lang na you keep moisturizing. Sometimes, because their skin is developing, if they're young, normally, nagfe-fade away naman. As long as you take care of it, you just teach them not to scratch it. Hopefully, they will outgrow that. So, it would be better.
That's true. Ayan, so we're getting some messages. May dalawa pang hindi nag-comment, Doc.
Oh, let's try to call them. Baka mamaya. Christine Concepcion. If Christine Concepcion is here, then so that you can get your GC.
That's true.
And then, your favorite...
Jamon Kim. Sorry, Doc. Halata bang favorite natin ng...
No, because she's also the last. Sometimes you remember the last question.
That's true. Thank you. Ang sarap pala when Doc's on your side. Okay. So, ayan. So, Doc, what can we expect this coming November? Ayan.
So, it's nice also that we were able to do it because November is our anniversary month.
Happy anniversary, Dermclinic!
Yeah. So, Dermclinic is not my age. It's older than me.
Ilang years
because
na, Doc?
It started since 1971. So, sino sa inyo yung buhay na nun? Don't worry, kasali tayo dun sa hindi pa.
Okay, tama. Hindi pa tayo basta.
But, it's been here since my dad started it. But we're continually offering the same quality of care. But of course, we know that there are evolving needs of today's patients. So we're trying to adapt to that. So now that it's our anniversary month, we're turning 53.
53?
Yeah, it's 53 years already.
Wow.
So yeah,
Grabe.
we have, hopefully if you've been to our clinics or if you haven't been to our clinics and now you want to know more about it, just visit any Dermclinic branch because we have a lot of promos, we have a lot of activities that you can have and that you can get. So hopefully you can visit us. If you want to have a consultation and you haven't in the past, try to visit us during this time because you might get free products as well because we are giving away one thing that I'm proud about Dermclinic is we didn't just master the different services.
Ooh,
We were
yeah.
able to really provide good quality products under New Derm. So these have been available for over 30 years, I think.
Wow, yeah.
Yeah, and they've still continued to help our patients.
Yeah.
They've been good partners of our patients.
Yeah.
Alam mo yun? And we have, I know we have OFWs and people from abroad.
I can yes,
who
attest
really
to that.
come
That's
to
true.
the Philippines to just get
Yeah.
their stocks and then go back again. So
yeah.
hopefully, if you're from abroad and then you're coming back this coming months in November and December to visit your families, hopefully we can see you in the clinics.
We'll see you. And because one person forgot to comment, ayan, masyado siyang naaliw sa Dermclinic to the rescue, we will spin again.
Yeah, okay. We'll have one last spin. So 1, 2, 3, go!
Go! Ayan.
For our last spin.
Yeah, last spin for this live.
So hopefully, those who are still there,
Yeah.
hopefully kayo yung mabunot so that maka-reply kayo agad.
Ay, we have a winner.
Ooh!
It's...
Miles!
Congratulations, Miles. Congratulations to our winners. Ayan. So you can get your GCs. Just make sure to message our Facebook and our Instagram. Ayan. So, ayan.
You know, if for example, they want to have a consultation because this GC is 1,000.
Yeah.
So they can actually get a consultation plus products. Diba?
Oh my
Kasi it's
gosh.
already... So it's easy for them.
Tama. So you get a... Damn. That's nice.
Or if they don't want, they can have a facial because our facials are
Amazing.
1,000 and less.
yeah, I believe so. That's true. All right. So any final reminders, Doc, before we say goodbye to everybody?
So again, thank you for joining us tonight for our first live Q&A. So we were glad to be able to answer your questions. So we hope that you would join us not just today, but we have a lot of surprises in store for you. So we'll see if maybe we can see you again in another live or we can do something similar to this.
Ooh, nice. Anyways, thank you guys. Thank you so much, Doc.
Yeah,
And,
thank you.
We'll see you again soon. Follow us on our socials. Please like and share our postings. Thank you guys. Goodbye.
Bye. Thank you. See you in the clinic.
See you in the clinic. Cute. Bye.